Hello learners, welcome to the certificate course on drug-nutrient interaction. This is your instructor Sandhya. I'm going to introduce you to the drug-nutrient course and the effects of drug and nutrition on our body. Course contents. These are the modules which we are going to see in this entire course. This course is going to talk about basic introduction, what is a drug-nutrient interaction, and we are going to talk about the classification, how each drug and nutrient interaction is classified, nutrients and drugs, types of food that gives the interaction, and the drug-induced metabolic effects on each food on our body, and vulnerability, people who are more vulnerable, and the nutrition implications of each reaction, drug nutrient interaction in specific condition, and followed by conclusion. These are the course content modules. Now let's go to module 1. Module 1 deals with the introduction. Introduction speaks about course overview. Course overview generally deals with what is the basic information we have about drug nutrient interaction and how are we going to elaborate and read about it. The second topic gives definition, drugs and nutrients. The third topic gives medical record assessment and how is it going to play an important role in recording drug nutrient interaction. And the fourth one is defining what is drug nutrient interaction and what are we going to learn about it. Module 2. Module 2 deals with classification of drug nutrient interaction. There are various classifications of drug nutrient interactions that is happening in our body. They can be basically described as pharmaceutical or ex vivo bioinactivations. The second type is the pharmacokinetic interactions. The third one is pharmacodynamic interactions. And to follow this classification, we are going to deal with how protein calorie malnutrition creates a drug nutrient interaction dependency, impact of PCM on drug and nutrients, and how PCM, in PCM, absorption of drug, distribution of drug, and metabolism of drug and nutrient plays a role. Similarly, following that, impact of obesity on drugs and nutrients, how absorption, distribution, and elimination plays a role in the drug and nutrient interaction if the person is obese. The third one is module 3 that deals with nutrients and drugs. Under the nutrients, the topics that we are going to cover are how the nutrients are getting produced, that is nutrient protection, how they are getting absorbed, nutrient absorption, and what are the factors that is necessary for it to get absorbed, and what are the factors that are getting affected, like time factor, altering the pH, damaging the intestinal lining, competing for absorption, and binding. And following absorption, we'll touch upon nutrient metabolism, that is affecting the enzymes and competing with the enzymes. And following that, nutrient excretion, how the nutrients get excreted, mainly because of the decreased kidney reabsorption and increased urinary excretion. Now, under the same topic, we'll see how drugs are getting absorbed, how drugs are getting metabolized, and drug removal. So the topics are drug absorption. So what are the topics under drug absorption? Decrease stomach emptying, binding to medications, competing for absorption, and altering acidity. And during the metabolic stage, under the drug metabolism, we'll be touching upon affecting the enzyme system, interacting with medications, and structural similarities. And drug removal, again, the elimination, affecting enzymes and altering the pH. The next topic is module 4, food types. How different food types influence drug nutrient interactions in our body. So what are the types of food, classification of food? High fat food, protein rich food, high fiber food, high carbohydrate food, purine rich food, and food that are very rich in metals. Now let's jump on to module 5. Module 5 deals with the metabolic effects and nutrient depletions. how the body reacts to the different types of drug nutrient interactions, plus already existing metabolic. People must be having a lot of metabolic diseases like hyperglycemia, hypoglycemia, lipid changes, the protein effects, how mineral depletion acts, vitamin depletions, effect of alcohol, alcohol on medicinal drugs, alcohol on nutrients. Our next topic will be vulnerability. Module 6. Module 6 deals with vulnerability. Who are people who are more vulnerable for drug nutrient interaction? Elderly, and we'll deal separately the pharmacokinetic parameters in elderly and common drugs that is used in geriatric care, and conclusion in that. And as well, we'll touch upon pregnancy, because pregnancy is also a very important vulnerable stage. Drugs used in pregnancy and their effects on the fetus and as well as the mother. Next topic will be module 7, nutritional implications. What are the different nutritional implications that an individual feels when they undergo a drug nutrient interaction? First one is perception. The second one is dry mouth. The third one is taste disturbances. The fourth one is gastrointestinal disturbances. Fifth one is weight gain. The sixth one is oral mucositis. Seventh one is NSAIDs. And eighth one is tranquilizers. Our next topic is module 8, drug nutrient interaction in specific conditions. Pre-existing specific conditions play a major role in defining the drug nutrient interactions, especially people with immune function modalities and infectious diseases. So we'll touch upon certain viral infections, like introduction on those things, and effect of drugs on major nutritional status on infectious diseases like HIV, tuberculosis, respiratory infection, diarrheal diseases. Other specific conditions like autoimmune diseases, type 1 diabetes, rheumatoid arthritis, irritable bowel syndrome. These are the common things which we see in a large amount. Drug nutrient interaction in patients with cancer. So we will just touch upon the introduction and the role of therapeutic modalities and common drug-induced reactions in cancer, patients suffering with cancers. So the next and last module is conclusion. This will deal with how to identify DNI, how to prevent DNI, and how to do the management of drug nutrient interactions, especially for healthcare givers. So we are at the end of drug nutrient interaction course overview. So meet you on the entire certificate course. Thank you.